Hello, everyone. Welcome back to our special series of Collab Conversations podcast. I feel like we should call this something when we do it, four of us together. I don't know what we should call it, but we'll find a name. We were just chatting before we started recording about how the last episode we had called Life After Cancer Now What, and there have been some changes in Yuan's diagnosis. So I think we're gonna explore that today, and we'll see where the conversation takes us. But Yuan, do you want to maybe like kick us off and update us with where you're at?
Sure. Good morning. My name is Yuan. In September 2022, I was diagnosed with stage 4 oncogene addicted um, lung cancer. So that means that my cancer has a gene mutation that we could target. And thankfully, I had a little over 2 years of targeted therapy where it was just a pill that I take at home. And I only went to the hospital every 3 months for scans to see if my cancer has progressed or if something's happened to my cancer. And I had really good quality of life for 2 years and a bit there. Unfortunately, as expected with these types of cancer, they do mutate to avoid the control that the drug has given them, and they start finding different mutations that will make them grow again, which is what happened to me earlier this year. And we have to come up with a new treatment plan. And unfortunately for me, the next treatment plan is really very different. First of all, it has chemo on day 1 of the treatment, and then it has a drug, a monoclonal antibody drug on day 2 of the treatment, and the cycle is every 3 weeks. Actually, we started out with weekly infusions of the monoclonal antibody, which they call 1 dose, but it's really like 3 times the dose you would normally get later on in a treatment. And it really compromised the quality of my life in more ways than one. First of all, is all the treatments, going to the hospital and all the infusions and trying to find veins, and the amount of torture when it comes to that type of treatment, especially life after an oral treatment. Um, and the toxicity is inevitable, and it's much higher grade than previous treatment that I was on. And it has made me question, like, is a juice worth the squeeze? Like, I heard it new, it came from our Facebook group, but it's really enlightening to hear everybody share the same adverse event experiences, and trying to cope with it, and having really honest discussions with the doctors about, like, do I pause or suspend this treatment because I can't tolerate the side effects? Like, do I then take the risk and let my cancer grow? Like, these are very real conversations we're having now. It's not like the cancer is killing us, is that the treatment is, making us question whether it's worth going forward. And these are very hard questions. And it's very different to hear the drug manufacturer and the people and the scientists behind making this drug talk about it. They're so excited about clinical trial endpoints like overall survival and progression-free survival. And, oh yeah, 40% have, don't quote me on this because I can't remember the data. Oh, like a large proportion of patients have grade whatever adverse events, and they don't really focus on that. But when you talk to the people, the real people on the ground taking these treatments, we're asking these questions, and we're asking, like, is it really worth it? And I can tell you, my first month on this drug, I've had tantrums. I started screaming, like, I don't want to live like this. Like, I'm very honest with myself, like, and honest with everybody else there. I don't want to live like this. It
It's
was awful.
I'm so
And I'm only
sorry.
just starting to come out of it. I still have tons of side effects. They're unexplained ones. Um, so I'm in a position now where I'm taking pills to manage the side effects from the pills that were used to manage the side effects. Get it? Um, so yeah, this is where I am.
I'm so sorry to hear that. It's awful, and it's an interesting point. A couple things come to mind. So, like, I mean,
I was talking about like my time during chemo because chemo made me really sick. Obviously, like I get these really high fevers and essentially like I'd have to go to emerge every time I had chemo. And lucky for me, it was a short period of time, so I can't compare our situations. But what I was saying once, like I was talking about my friend, and I refer to my time in treatment and having cancer as like when I was sick. I was sick before. And my best friend's like, it's interesting because, you know, the cancer didn't actually make you sick. It's the treatment that made you sick. And these treatments that we have like do actually make us sick, and patient experience is something that I've been talking about a lot lately. How do we measure it and how do we factor it into like our treatment decisions and what we can live with and what we can't live with? Because I don't think it's included enough in either trials or innovation of like, what do patients want? What can they live with? Because survival is not always the most important. And certainly, like, I made a lot of treatment decisions, and still, because I'm in adjunct therapy, so I still have to make treatment decisions based on outcomes that matter the most to me. And survival isn't always number one. It's quality of life, it's fertility, it's other things that like I really value because those are things that will help me live a life that's more meaningful. Um, Over the last couple of months, I've had issues with my adjunct therapy. And so I've been suffering from a lot of chronic pain. And my oncologist switched me from, I was on a drug called letrozole, which, so I'm on three medications, for 5 years after treatment. And so one is called Zoladex. It puts me in chemical menopause. The other one's called Zolmeta, which are these bone infusions I get every 6 months. Also makes me very sick. Um, and then one I take every day, which is called like either it's an aromatase inhibitor. So I was on letrozole. I was having a ton of chronic pain, like couldn't go bowling with my nephew or, blowing my hair dry. Like, so my oncologist switched me to another one called anastrozole that she thought might be better. And at first I like was just not feeling well, but I thought I switched a bunch of things at the same time, so I wasn't sure what it was. And then progressively I was getting like more foggy, more tired, more depressed. I was like crying all day long. I couldn't get any work done. Like I was so foggy and so tired, I couldn't even read a sentence. And it was getting worse and worse, and I had a ton of stuff to do, so I'd like be dragging myself around, and then anytime I had a free second I was like crying my eyes out, like just never been depressed like that in my entire life. And I realized it must be the drug, so I called my pharmacy. I was like, I can't live like this, like put me back on the letrozole. I can live with the pain, but like I cannot live with this level of fatigue and depression. Like I want to jump off a cliff. Like I've never felt like this in my life. And so I went off. Within 36 hours, the depression lifted. Like my personality came back. Like I stopped crying all the time. I still have the fatigue from like switching around, but yeah, I've never experienced something like that. And so like I'm active on social media, and in the middle of all this, I had posted like a random TikTok that's gone viral actually. And like I only have two that have gone viral. One about hair, which is mostly what I post about, but in the TikTok community, I've found, all these women post breast cancer or also, 5, 10 years forever on these adjunct therapies. And the the therapy for breast cancer is basically like, let's starve your body of all hormones. Like that's what they do. Like there's nothing more innovative than that. Like, oh, you have an estrogen-based cancer, like we're just going to starve your body of estrogen and progesterone, which is like really taxing. And so I post something and I have like over 600 women commenting and still getting comments every day about the level of depression, fatigue, weight gain, that they're living with, like the other meds that they're having to go on, and the quality of life, because like we're just hoping that our cancer doesn't come back. And then I have the ones commenting being like, I couldn't tolerate it, but my cancer came back. So I didn't do the therapy and then now I'm sick. Or there's other people, who couldn't do the 5 years and they're fine. But it's interesting, like these choices that we have to live with and that you have to make these decisions on. And I don't have an answer to it. I just like hope that there's better and better therapies that like say like this, like the balance of survival with like what we can live with and things that we value, because there is like a big gap until like what we're living with on the ground and then what's happening at the like develop like pharma level, at the innovator level, and at the regulatory level. And of course, like we're all doing work and hoping to bridge that gap, which is amazing, but like it's also frustrating to live it day in, day out.
There's so many points that you brought up. I don't even know if I can touch them all, but just from my own personal perspective, and I went through chemo and I went through clinical trial and I went through different immunotherapies. Um, uh, I'm not on any treatment right now, but I have a permanent ostomy. I have adrenal failure from the treatment, which almost killed me. I have neuropathy in my hands and feet. And you touched on the psychological aspect, which we could probably have a whole podcast just on uh, the anxiety and all of the other emotional psychological effects. Um, but the thing that's I find people will look at me, and they'll say you're fine, you're great, you survived. It's amazing. They have no idea what you went through, what you're going through, the fact that nothing, I had a bypass surgery. That's how all of this started. They fixed that, and then you're good. Cancer doesn't work like that. You fight it, you beat it down, and you hope at best. That's the best, and then you deal with all of the collateral damage to your body, to your mind, to all of that stuff. So and of course it's always these questions when you're going through the treatment. I know I do a lot of advocacy for immunotherapy, and we talk about it's not chemo. Well, yeah, it's not chemo, but it's still radically changing your body. It turns your body into autoimmune, hyper autoimmune situation. I had a colon cancer, so the digestive side effects are horrible. Fatigue, all of this stuff, and you don't know if it's even working. Especially with immunotherapy at the beginning, the tumors swell. So when you do your scans, it looks like everything's growing, and you don't know, is it really growing, or is it, they call it pseudo progression, and you're going through hell. And having these internal conversations, because who are you going to talk to? You can't tell your family or your loved ones, because they're expecting you to be like fighting, and thinking about. I always like think about that movie, the Three Billboards movie, and Woody Harrelson has a diagnosis. I forget what cancer, and he goes out and he shoots himself because he doesn't want to go through what all of us have gone through, and it resonates because you have sometimes those fantasies of maybe maybe it's not worth it. And this conversation, I don't think happens, at least not in the public. No one wants to hear it, right? Your family doesn't want to hear it. I think there's a little more now because of the MAID option, and I know that a close friend of mine, his sister had a stage 4 pancreatic, and she was in absolute agony. And in her case, I don't think there was much they could do, and she opted to terminate her life in a more dignified way instead of just suffering for more months. But I think one of the points that was raised is the statistics, and they talk about uh, this drug is fantastic and it's getting approval because it's achieved 6 months of extra overall survival. But what do those 6 months look like? And then what does that really mean? Um, I think these are very important conversations that only people who've gone through the treatment can really have. But I don't know um, um, how we get these discussions heard by the approval people, the drug people, and I think a side of it is the additional support. So for in my case, we have a really fantastic wellness center, and I probably spoke about it before, but just to go and do a meditation group with people, and then it turns into like a support group at the same time, or a yoga, or even get a massage, and then or talk to someone. They have counselors. I don't think there's enough push and enough resources there. Our system is so strapped for money just to get you in for treatment and get treatments approved. They don't think enough about the other side of dealing with the person. There's like a human being, like we're guinea pigs, but we're like human beings at the same time. So I think like a lot of this is very important.
Yeah. Um, I talk about palliative care a lot, and I think that should be much more accessible. I don't think we have enough doctors here in Canada, um, but that's part of it. It's focusing on the quality of life here. The drug that I'm on right now, their discussions as first line treatment, and some of the data coming out is that they have much more superior um, progression-free survival, like over a year, like we're talking 14 months more progression-free survival compared to an oral inhibitor that I used as my first line. And now the discussion is shifting to people taking an infusion-based drug as their first line lung cancer treatment. But you have to start asking questions like, what is your quality of life? You are literally strapped to a pole for 5 to 6 hours every 2 to 3 weeks versus a pill. And now data is coming out that if you have, if you're older, if you're a senior above a certain age, adverse events are the number one reason why you would suspend an infusion-based drug treatment. So those things are coming in. Like, what is survival? Is it survival at all costs, or it depends? And now I'm just so glad we live in this day and age where we get to debate options and that we actually have options. But I would certainly hope that the drug manufacturers are taking these considerations when they make the next generation, that it's not just survival at all costs, that we're talking about quality, we're talking about how to manage this. And in fact, I'm kudos to the drug manufacturer. They're actually putting in clinical trials into how to manage the side effects. I'm glad they're doing it, and we are coming up with much better treatments now to manage some of the more common side effects based on the clinical trials that they're sponsoring. But it still comes back to the fact that the drug is toxic. It's also not as well in a second line setting as some of the other treatments that we know for second line, but it's still better than many of the second line treatments available to me. But there's just a lot to think about when it comes to side effects and quality of life. I'm just glad we live in an age where it's more personalized now and we can make our own like decisions. I mean, we have to second guess ourselves all the time, but we have options. I'm glad for that.
And thank goodness we have the internet and community groups and support groups and Facebook forums, because could you imagine before the year 2000, what that was like and how hard it would have been to actually research and find information and make these choices, because it would have taken
I don't think patient advocacy was even a thing. And patient advocacy can only occur if people who have been through the treatments are able to reach out and connect with other people. So if you were lucky, maybe you had somebody that you knew that had been through something that you could kind of ask about, but just in terms of knowing what are my options, or what questions do I need to ask, or how do I find out how somebody else dealt with this? I don't think it was even something that existed because there was no technological way for even like the four of us today to connect and have these conversations. So I think you're right. I think the danger with the internet is falling down the rabbit hole of statistics, and that's a whole um, very difficult thing because you start to see what your odds are, and then it's very hard. And also, a lot of those statistics are not necessarily up to date, so we have to be careful what information we get. But the connecting with people, that's really important.
We also need to factor in that doctors are also much more connected now compared to, so it's made access and equity from a geographical point of view better, especially for patients in rural areas. Like I go to a cancer center, there's actually a thoracic oncology department versus if you go to a rural hospital, you're just going to a general oncology department. But a general oncologist have access to thoracic oncologists now because of the internet, because of video conferencing. So I think we have a lot more now at our disposal compared to maybe even 10 years ago.
But there's work to be done there because there's a lot, there's so much changing so quickly. That's why they're employing AI now to analyze clinical trial data because there's just so much happening, and it's hard for doctors, especially if they're doing a general oncology practice, to be up to date. So that's why this kind of patient advocacy to bridge some of that is I think really necessary.
Definitely.
So I have a couple of things I want to ask, and one, Gordon, is something that you had mentioned about, how nobody is really talking about, like not just the side effects. I find like a lot of people are not talking about the side effects, but like that desire or that intolerability of continuing with the treatment. And, like where you get to that place where you have to make that decision of, do I continue with this treatment even though it's making me want to jump off a cliff? Or do I stop and risk getting even more sick from this disease? And I feel like that's a really important place that I would like us to continue this conversation. But I also, Robbie, you talked about the patient experience. And I feel like, like the timing is really incredible because the International Society for Pharmaceutical Outcomes Research, ISPOR, their conference is actually in Montreal starting tomorrow. And one of the things that they have also started talking about is patient experience. But being a patient advocate, I'm afraid that like when the economists or the health economists start looking at patient experience, they're going to turn it into an algorithm, and they're going to remove that actual patient experience from the patient experience. So I would love to hear more on your thoughts about the patient experience, and I I I would love to see pharmaceutical companies do more on the patient experience, but I also feel like it's not just up to them. It's got to be the regulatory and reimbursement too, who need to step up and say, like, this is valid data. We need to better understand it. We need to do more to include it in our assessments, because if there is a drug and, like the HTA, for example, is doing the value assessment of a drug, well, they're not really taking like this actual patient experience into consideration. Like they're not hearing people say, I I I would rather jump off a cliff than continue this treatment. And I
Yeah.
will stop talking now.
I think part of it is sampling. It's the sampling of the interviews, the patient interviews that they do capture here. I mean, if you've suspended treatment or opted not to go on treatment, you're probably letting cancer
Yeah.
Um,
Let me ask you a question about that because I have done those patient submissions for HTA, and I've never had a patient who's responded who said to me that I would rather jump off a cliff than continue to take this treatment. So do you think that maybe the people who are in that position who feel that way are not responding to the surveys, or people are maybe not providing all the information in their survey because I don't know, they feel like maybe they should have responded better, or, that like they're just not bringing everything to the table when they're filling out these surveys.
Well, and when are they being surveyed? Because the difficulty is, and I mean, I got to that point. I was on a fourth line treatment that made me so physically sick that and it was pills, and I know we can discuss pills versus infusion. My experience is every time I had a pill, I had such horrible nausea, and then I couldn't feed myself the pill. I'd say I'd rather be strapped to an IV where they just pump me with the stuff. But that was my experience, and I was told, oh, I have 28 patients and there's no side effects, and I'm like in my bed, like green and puking, and um and I told my wife, I said, I can't have another pill, I can't do it. And she's like, well, try to like just finish this 2 weeks. And I was writing to my oncologist, and he said, oh yeah, in 5% of cases it could be toxic. Oh, thanks for telling me now. And then you get to the point, okay, now I've done 4 lines of treatment, and what are my options? And it was, well, we can go back on the original chemo that didn't work. So you're faced now with a decision. I have X time left. How do Will it be X plus 2 more months or 3 months, but I'm going to be miserable the whole time? Or will I have a certain period where I can have some kind of quality of life? And you've got to make those decisions. But if if in most cases, or almost all cases, those patients don't survive, and they're not filling out surveys when you're lying in bed in agony or nauseated or whatever. How are we even going to get that data of that decision making process? Um, so the only reason I went for the second opinion and then did this other treatment, because it was based on a sequencing, and it was based on a meeting with an oncologist, and the oncologist said, I have a clinical trial, but I also have a 2-drug immunotherapy, and here's why I think it may work. And he did lab work, and so there was some corroboration where I felt, okay, there's a glimmer that maybe this will help me, and it'll be a different kind of dynamic from all of the chemo that I'd had for years and years before. But if the question had just been, well, we'll just throw you on another chemo or throw you on one of the chemos you had, most likely I would have said no, I won't take any treatment, and I'll live as long as I can live. And so it's that point of decision making that I'm not sure how surveys will capture it, because in many cases the patient isn't surviving at that point because the cancer, you're not on treatment, the cancer is growing. So, and I agree that all of my misery from all of it was treatment related, not cancer related, but ultimately the cancer is going to kill you if you don't treat it. So yeah, that's an interesting point of where you get the data. I've done a lot of post-treatment surveys, but not in that decision-making phase of treatment.
yeah, I mean, I don't think in my worst moments here that it's survival minute by minute, day by day. Like I probably wouldn't answer a call for a HTA request for an interview and sit through, an interview with someone and actually elaborate on my experiences during my darkest days, right? Usually it's when you feel better, then you start talking, oh, well, you know, I had bad side effects, but it wasn't that bad. Ha ha, I survived it. But I think being able to interview patients in the thick of it, I think that's really important. But most of us are too sick to be interviewed at that point. So yeah, it's a really good point.
I wonder though if there's like, I don't know, like they're doing kind of like, if they're answering it's like what they should want, like or there's also like this expectation of like, well, I'm sick, so I'm feeling sick and it's normal, versus like we could do better, like this mindset of, because that's what I saw in a lot of the comments I had. Well, this is what I need to do, right? Like almost like there's no other option or no better way. So I don't want to say hopelessness, but it's sort of like a practicality around like, well, this is cancer treatment, so I'm supposed to feel sick. This is cancer treatment. This is what happens, right? So um I don't I think maybe that's what could be what you're seeing. It's just like, how do you kind of prime the patient without putting in bias? And so it's like really, I think, asking the right questions and getting the right experience metrics that are down, so it actually is like reflective of what the experience is really like, and getting those answers from like all sides of it.
Yeah, you know what, you're very right there. It's about anticipating the side effects and what it would do, and actually being proactive about it, and having a very supportive medical team who actually has all the prescriptions already for you. So yeah, I'm very thankful that I had a lot of things on hand to manage the side effects. And the couple of things that is really frustrating to me are the ones where it's not something they expected, and now I'm like grappling a little bit. What are we supposed to do with this? Because I'm still feeling tired. I'm still feeling this, and they don't know how to manage it. All they could say is, well, you know, it looks like you're responding to treatment, and therefore here is a side effect you need to tolerate, versus here's a side effect we can actually make you feel better, which is what's
It's
very frustrating to me right
and
now, is that, well, it's a side effect and you're going to have to tolerate it.
and it's difficult when the drugs are new. So in my case, I was on heavy opioids for pain because I had bone mets. I had, when the immunotherapy started to work, I had to withdraw off of the opioids, which was a nightmare, and that alters you forever also. So then in the second year of treatment, I was having all kinds of issues. I was throwing up, I couldn't sleep, and we were all assuming this was still part of the withdrawal. And at the time, they weren't even familiar with the adrenal failure side effect, which they are now. And so they put me on. They were giving me Ativans or other kinds of tranquilizers and things to try to help me. And because they were assuming that my side effects were caused by one thing. Then they thought it was maybe thyroid, because that was a known side effect, and they put me on those. Ultimately, I ended up in the ICU, and they realized that I had, like, my cortisol was 0, and it had been going down and down and down, and it was my adrenal gland which was basically wiped out, and I had to go on steroids. And of course, the dilemma is with immunotherapy being an autoimmune causing a drug, they don't want to put you on steroids because it tamps down, and also they don't even still know the dosage. So the protocol was 2 years of treatment. Um, so the doctor wants me to be on the treatment as long as possible, but it turned from a treatment that was saving my life to a treatment that was ultimately killing me. And I didn't understand it because I felt better earlier in the treatment, not at the beginning, but say in the middle part. But at the end part, I was miserable until they understood. Then they got me on the steroids, stopped the treatment, and everything sort of turned around a little bit. So some of that is like, they don't always know what the dosages are. They don't know. how long to give the treatment if you're responding. Immunotherapy is a weird kind of a thing because sometimes when they alter your immune system, you can have, I know cases of patients that have two treatments and then they get a pituitary strike and they take them off, they put them on steroids, and then they get to NED with only two treatments. Other people could be on the treatment for 5 years and it holds them at bay. So there's just so much that they still don't know. And we're grateful to have the new treatment. And we're grateful that a doctor says, oh, by the way, there is something else I can give you, because you figured, okay, I'm now on my fifth line. What do I do? What if this doesn't work? But often they're new, and they don't have a lot of history with the drug, and they don't know what some of these side effects could be. And you can, we always laugh when we see the commercials, right, where they talk really fast about how many ways the drug could kill you. But the fact is, these treatments could kill you in some cases. And we're the patient, in that position. So I think the only thing, like, this is what kind of motivates me to be involved in these kind of conversations, is because miraculously for me, I'm still alive now, 5 years post-treatment. And so I'm really, really lucky. With all of the things I got to deal with, I consider myself fortunate. I consider that it was worth all of the pain that I went through, but because I'm here where I'm at right now. So what can I do? The only thing I could really do is tell my story, to get that information out there, because it's not like I went in, had an infusion, everything was great, and now I'm fine, because it's none of those things. And it's still living, day by day. I think part of it is, like, I may have these conversations with a psychotherapist. I remember having a conversation saying, they gave me 100 dilaudid pills for my bone met pain. And then you think, well, if I took all of them, would that kill me tonight? That's a thought that you have in your head, right? But that's between you and a therapist. That's not going anywhere. That's not going to a doctor or to a survey or to anything. But I think it's we hear this, you got to just be positive and keep fighting, and it's a war, and you just put on your armor and you fight, and nobody talks about how dark it gets. And it's important to, like, acknowledge the darkness, because it's hard. It's really hard.
Yeah, I think I'm hearing a take home here. What Robbie was saying is manage expectations. Like, these are the side effects and these are how we're going to manage them. And also a proactive strategy in developing side effect strategies, like side effect management strategies. So kudos to the drug companies when they put in clinical trials to manage the side effects, and actually publishing it and letting other oncologists know about it. But part of it is also knowing if this is going to get better, and managing that expectation. And I don't know if that could actually be something we can expect, because that's also very individualized. But anyway, this is sort of my thoughts: expectations and managing side effects.
Yeah.
But even that point, it's like, I've heard so many times, oh, I took the treatment and it was really fine. I was fine. And I'm like, well, how come I'm the only one that's, like, feeling horrible on this thing? And I think maybe that ties into a bit of the social media stuff, which, being my age and wherever, I'm, like, not a social media person at all. But I could see how that at least allows you to reach out and get a better sampling of experience than the anecdotal, oh, I know someone who did that, they were fine. It wasn't a big deal. And I know it's probably not true, and probably that person isn't telling the true story, that you're hearing second or third hand. So they have that expression toxic positivity, right? Where everyone they want you to be positive because they don't know how to talk to you, right? And so where do yeah, so where do we have the chance to say, well, this is really horrible, and I really thought at some point I'm going to stop the treatment and I'd rather die. Like, where's that conversation in any of it,
Yeah, we
right?
should be striving for good, not fine. I mean, that's the thing, right? And so that's the normalizing too of like patients, like we think that we should have to suffer side effects because we have cancer and this is the cost of living. But like, how do we get to a place where we're like, we're good and we want to be good, but there is a lot of like everybody else wants us to be good and we're not allowed to be not fine. And like people get really uncomfortable when I'm honest about it. Like all weekend I'm catching up with people. How are you? Honestly, it's been a really rough couple of months. And like people don't want to hear that. It's like, well, you look good. You sound good. Like, okay.
Yeah. Well, I think
It's true. I had a situation where a friend had texted me at some point when I was in the middle of treatment, and I never responded because I definitely didn't respond to texts, in the midst of the hell. And I tried to get back to people, but I didn't get back to him. So he's like, "Oh, you're mad at me or whatever," like this kind of thing. I said, "No, I mean, you texted me. I mean, I did see your text, but I was in misery and I wasn't responding. So it's hard. I mean, it's these, maintaining these kind of relationships on a sort of truthful level. It's difficult. It's difficult.
Also, just like it's not about you.
Yeah, well, I know that's always the case, right?
Yeah.
Like we need to make them feel comfortable because they're petrified. And the other side of it is, which is a different topic, but it's always like, oh, what did that person do to get the cancer? Oh, his job was too stressful or whatever, because everyone is in fear that it's going to happen to them, right? So yeah, this is why I mean I value these kind of conversations with other people who've been through the journey, because you really don't understand it unless you've been through it, and it's important for us. Certainly I feel it's important for me to be able to have these kind of open conversations.
Absolutely. It's important also to like for others to like so they listen to it and they know that they can also have these types of conversations.
Yeah. And even if they're not on the podcast with us, but they know that this is also happening to other people, it's not just happening to them.
But isn't part of it is that we as humans we tend to go into fix-it modes. So like when you tell your friend, look, I've had a really rough weekend, like you just want them to say, I'm so sorry. Instead of trying to say, well, is it this? Can, maybe if you do this, like I think if we take a step back from the fix-it mode when we respond to our friends might be a little bit more honest about how they feel right there and then there. It's okay. You don't have to have an answer for everything.
Mhm.
I think
I'm sorry, I've had situations where people say, well, my friend, he's very sick with cancer, and I told him about your experience, and I want him to like reach out to your resources and your oncologist and this and that, and he doesn't want to listen. I said, you know what you should do? You should just be a friend. Just why don't you just go over there, and actually why don't you talk about the hockey game or something? Like be like have a normal conversation, and not a like I'm going to try to find a way to fix your cancer. I mean, the person's living that 24/7. Like just come over and just, have a donut, or, talk about something else. It's and people don't think of that way because they want to feel like they're helpless and they want to do something. But sometimes all you need is just a person to kind of hang out with and not be in cancer land for an hour.
It's funny, like you say that because I'm a classic fixer myself, other people, like that's just how my brain works. And I've been trying to stop that in myself and for other people. And like it's an automatic thing, but like what I'm trying to do is trying to like listen and just be like, ask the question to the person, hey, are you looking for advice right now? Or are you just venting? Like, do you just want an ear?
Mhm.
Like, what can I do? What role can I play as your friend right now in this situation? And it, like, asking that question is actually really meaningful because it also sets a tone for the conversation. And like what they're kind of looking for in terms of interacting. And, I got caught in it because I was like trying to do it. Someone was talking about something and she actually was just like, I'm not looking for a solution. I'm just chatting. And I'm like, yes, I got caught in that dynamic. And she said it to me. And it's a good example too of like, we play multiple roles with the people that we care about in our lives and um, let them kind of take the lead on what they're looking for because not everybody's looking for a solution.
Yeah. Okay, so then maybe just quickly to wrap up, um, maybe just a minute on what you want people to take away from this conversation. And we'll start with you, Yuan.
I think this is just a general everybody, including drug manufacturers, that it's not survival at all costs, right? Like put in the money to manage the side effects. I think that's really important. Put in the investment into managing expectations. To everyone else who's trying to support a friend with cancer, please do remember that we are people first and foremost. I know that there is this sort of this shadow of cancer hanging over us all the time, that we're living with cancer. But we are people first. We are human beings, and put that first and foremost, that we have feelings. So I think that's really important.
Yeah. Maybe Robbie, you go ahead because I know you need to get onto another call. So
Yeah. Just that like patient experience or our experience looks different and um keeping in mind that there's all sorts of things that we go through and if industry happens to be listening, just to include patient experience and to really factor it in as early as possible.
Gordon, go ahead.
Yeah, I mean, I would echo everything that was said, and I would just add that um, there needs to be more call it holistic aspects of treatment, psychological help, other. It makes a huge difference to walk into a wellness center where everyone has cancer and you're doing a yoga class. You're not at the gym doing a yoga class. You're actually just there to be with people and try to do something that's not a cancer treatment. And dealing with the emotional and psychological aspects, it's better now, but it needs to be even more resources need to be given there because a lot of this dealing with these issues that we've discussed and the decisions that we sometimes have to make, it's hard to do it on your own. So talking it through with a counselor can really kind of help you to kind of envisage, yes, it is still worth living, and even the side effects, it is worth going on. Or maybe I need to take a chemo break, or these kind of things you can have with a third party that isn't somebody that you know. It allows you to kind of express some of those questions and work through them. So I think that those resources need to be emphasized more and more for cancer patients.
Yeah. Well, once again, thank you all so much. I'm glad that we've got all of you for one more day. And I'm looking forward to our next conversation. And again, these conversations are always so enlightening. And I do hope that industry will listen and hear what you have said. And I will make sure that they specifically listen to this episode. But thank you so much and have a wonderful rest of your day.
You too.
Thank you.
Thanks. Good to see you all.